We happen to be so fortunate to live in a place like Central Oregon, where we have top-notch physicians, we have world-class hospitals in one of the best places on earth.
These days, there's a lot of talk about healthcare, but healthcare means different things to different people. Everyone has their own story. She just found out she's pregnant. Her husband was laid off 3 months ago and lost his benefits. And this guy hasn't even been to the doctor in 10 years. Her mom is recovering from open heart surgery. He has the flu, but hasn't been able to find a doctor since moving to town. Unfortunately, regardless of our personal stories, all of us are trapped in a broken system that doesn't actually support health.
It's not hard to recognize that our healthcare system is in crisis.
We have 30 to 40,000 people in our county who have no insurance.
Healthcare costs are spiraling and they're out of control.
The system is difficult to navigate.
I've had to re-register, fill out 6 new pieces of paper.
The more things you do to a patient or for a patient, the more you get paid. So it's incentivized to overutilize services and procedures.
We have clearly the most expensive healthcare system in the world, and we have to ask ourselves, what are we getting for that?
Many of us believe that the model of healthcare delivery that we've lived in for so many years is no longer sustainable.
The best organization or best group of people to solve this healthcare crisis are those that are actually dealing with the problems on a day-to-day basis, and those are the healthcare providers. People who are actually delivering the care, interacting with the patients, are the ones who best can recognize where the deficiencies in the system are located and where improvements can be made. The Triple Aim was developed by the Institute for Healthcare Improvement, which is a not-for-profit organization which is really dedicated towards improving the health worldwide of our population. And the Triple Aim, stated simply, is number one, to improve the patient's experience with the healthcare system. Number two, to improve the health of the community as a whole. And third, really to try to control costs where possible.
So where do we start? We all know many factors like exercise, genetics, and where you live contribute to health. But most of these factors aren't directly related to healthcare. So let's talk money for a sec. This circle represents the GDP, or gross domestic product. It really just means all the money the US spends in a year, which is a lot of money. We spend 17% of that on healthcare. By the way, 17% of a lot is still a lot. This chart shows the GDP of a few other countries. The slices show how much they spend on healthcare. Now, countries don't all spend the same amount of money, right? This graph assumes that the GDPs of all countries are equal, but they're not. Let's fix that. So now, if you look at Japan, for instance, you see that it spends 8% of its GDP, only $2,500, on healthcare for each person. Now, we already know that the US spends 17% of its GDP on healthcare. That means the US spends an average of $6,300 per person. Now let's switch the chart up a little more. This graph shows life expectancy, or how long we live. Look at Japan. I mean, really look at it. Now look at the US. Do you see that? That means Americans spend more money than any other country, and we don't live nearly as long.
Our current healthcare system has been in effect in its current model for a long time, and it has a piece of it that is working to enhance wellness, but it certainly has not made that enough of a priority to accomplish, I think, what is going to be important for us to do moving forward in the future. But I think we're all recognizing we can have a bigger impact on healthcare in general, the health of our communities, controlling the costs of care, etc., if we make prevention and wellness care a higher priority than it's been traditionally in our current and previous model.
Prevention isn't part of our medical system. 70% of healthcare dollars are spent on 10% of the US population. patients with preventable chronic diseases like diabetes, obesity, and high blood pressure. If we don't make a change and create a system that encourages wellness and stops chronic conditions before they start, healthcare costs will continue to climb. And worse, we will have done nothing to actually improve anybody's health. So we've been talking about money and numbers, but let's bring it home for a minute. We all know someone who doesn't have health insurance. In fact, a lot of us don't have health insurance. And if we don't have insurance, we probably aren't getting regular medical checkups, leaving us to interact with the healthcare system only when there's an emergency. Take this guy, for instance. He has the flu, and just like 40,000 other Central Oregonians, he has no health insurance and no regular physician. Without treatment, he'll probably miss a week or more of work, eventually ending up in the emergency room. We all know a standard case of the flu isn't an emergency if you get treated when you first get sick, or you have a primary care physician who can help you. This leads to extraordinarily high bills for patients, traffic jams in the emergency rooms, and skyrocketing charity care costs for hospitals. An emergency room physician should not be the primary care provider, but in many cases, they are the first and last line of defense for uninsured patients. Isn't there a better way?
When we talk about healthcare reform on a national basis, really what we're hearing about is healthcare insurance reform or healthcare finance reform. What we're working on here is healthcare delivery reform. The goal of the physician-hospital alignment is to bring together the hospitals and the physicians who have a shared vision of what our healthcare delivery system can be.
We really have the power to do something locally as opposed to waiting for the federal government to make mandates that we have to do something. To be able to somehow have control over our own destiny, so to speak, as opposed to somebody else controlling our destiny for us.
One of the real positive aspects of this is being very proactive on the patient's behalf, particularly on the preventative medicine side. And the example I'd like to give you is to talk about hip fractures in the elderly. As folks get older, they're at increased risk for hip fractures. Frequently they fall at home. If someone has a hip fracture, of course they end up having surgery. There are well-known complications from that procedure. Dying is also a real possibility. Some proactive things that we could do. A team could be sent into the home to identify places in the home where the patient might be at risk for falling. To look at throw carpets on the floor that might be slippery and cause the patient to fall. Checking and making sure that they have handrails in the bathroom and the showers, railings along stairs that they can hang on to keep them from falling. These are all relatively simple, inexpensive things that we can add. And when you compare it with the very high expense of surgery, prolonged hospitalization, it really would be an excellent way for the healthcare system and the patient to spend their money.
We are creating a system that focuses on a patient's best health interest. A patient-centered system means everyone treating you is in communication. They have access to your complete health records, which prevents things like repetitive testing, treatment delays, or potential medication errors.
Our breast cancer model is a perfect example of a patient-centered model. So what we have created for breast cancer is that when a woman is diagnosed with breast cancer, within 5 days, she will have appointments with all of the specialists who are involved in breast cancer care. She'll have appointments to see medical oncology. She'll have an appointment to see a radiation oncologist and a breast surgeon. She will also be contacted by a breast nurse navigator who will then connect her to all of the supportive services and programs. And so that's coordination of care that for the patient can feel pretty seamless, because all those appointments are made with specialists that are hand-selected by her primary care physician.
The PHA is focusing specifically on 3 areas to make this patient-centered model work: IT connectivity, quality care, and accessibility. The IT work group is researching the best course of action for electronically integrating all of the medical record systems here in Central Oregon. Another focus is quality. Caregivers in the work groups are devising a system where success is based on how effectively the patient is treated, instead of how many patients a physician sees. Easy, affordable access to primary care is a major hurdle for many patients. This lack of care leads to more emergency room visits and hospital stays. The PHA is working to increase the capacity of primary care providers in our region and connecting patients with care resources before health problems arise.
We're not reinventing the wheel. This is a system that has been experimented with around the country. We're trying to take pieces of other systems, whether it's from Utah or Wisconsin or Seattle area or Portland, and to accelerate this so we don't have to go through a process that others have gone through for 20 plus years of trying to create an integrated delivery system and going through a lot of failures and a lot of headaches and a lot of huge political turmoil. And we can ask other systems where they have run into their biggest problems and present to them what we're planning to do here and ask their advice and say, okay, how would you approach it? Every time we ask that question, they become excited. They say, you have a unique opportunity because you're a blank slate.
So what can you do? Being informed is critical to improving your health and the health of our system. If you're a well-informed patient, you're active in monitoring your condition. Well-managed diseases require fewer expensive emergency visits and hospital stays. Care providers can intervene and educate those of us who are showing early signs of chronic conditions.
A large portion of medical issues and medical problems we have personal control over. Whether it's diet, whether it's exercise, whether it's what we choose to do, we need to be very aware of that. The more we're aware of that and the more we can increase our own health, the less we're going to have to rely on those 10% of the times where it's going to be a medical provider to solve the problem.
The PHA is laying the groundwork for improving health in our region by building teamwork and relationships within our community. That's where you come in. Become informed about the issues facing healthcare. Lend your voice to the conversation. A successfully integrated healthcare model involves everyone. The entire community needs to be engaged in supporting health.
So we in the physician-hospital alignment are absolutely committed to building a new healthcare delivery system in our homes, in our region. There is no question that we will succeed.
We have this incredible opportunity
to be able to make a difference by changing the way that healthcare is delivered.
This is an opportunity that has come about once in my lifetime.
You can create a whole new system that no one else has created.
It's going to be a shift in the paradigm of how healthcare is delivered.
We can develop a sustainable, equitable, integrated delivery system that will really benefit all Central Oregonians.
We have a unique opportunity to do that just because of the closeness that exists in our community already.
The opportunity to reinvent how we take care of ourselves through the medical system.
And it's really all for the right reasons, with some lofty goals, and we're going to accomplish them.